Hello and welcome to our first installment of Audrain County Health Department's Health Corner. Each month we will post a new video dealing with a new topic concerning health issues in Audrain County. And today we welcome ACHD registered nurse Katie Swain. Good morning, Katie.
Good morning, Chris.
How are you?
I'm doing well, and you?
Good, good. Well, this month we want to key in on one of the childhood diseases that has recently been seen resurging in America, and that is measles. Katie, what exactly is measles and how can it be spread?
Measles is a highly contagious respiratory virus. It lives in the nose and throat mucus of an infected person. It can be spread person to person through the air by that infected person sneezing, coughing, or even talking.
Wow, okay. And now in general, what are signs people might be infected? Give us some of the symptoms and markers that people need to be on the watch out for.
Mm-hmm. Symptoms generally appear about 7 to 14 days after a person has been infected. Typically begins with high fever, cough, runny nose, red watery eyes. 2 to 3 days after those symptoms appear, a person may get white spots on the inside of their mouth. And then 3 to 5 days after those symptoms begin, it's when a rash breaks out. It usually starts, it's red, flat rash, starts in the face, the hairline, and then works its way down. It travels, goes to the trunk, arms, legs, and feet. And small spots can appear as bumps on top of that rash, and the spots may join and form like a big complete rash as it travels down the body. When the rash appears, a person's fever can spike to more than 104 degrees Fahrenheit. And infected people, they can spread the measles infection from 4 days before to 4 days after that rash appears.
Okay, now the rash you're talking about, chicken pox is another childhood disease. Is it similar looking?
The measles rash is flat,
okay,
not as bumpy.
That's
it's
bumpy.
more flat spots as it travels down the body.
Does it itch like the chicken pox does?
I don't believe so.
Okay, very good. What's the best way to stop the spread?
The best way to stop the spread is to be vaccinated.
Okay, and the parameters of being vaccinated. In other words, when can a person receive the vaccine?
Okay, the ACIP, which is the Advisory Committee on Immunization Practices, recommends that all people 12 months of age and older, they get a measles 2-dose vaccine series. Infants 6 months to 11 months, though, 1 dose is recommended only prior to international travel.
Okay, and does the person who has completed the 2-dose vaccine later in life, do they have to be revaccinated?
Okay, any person 12 months of age or older who has documentation of 2 MMRs, which is the measles, mumps, rubella vaccine, or 1 dose of that MMR and 1 dose of the Attenuvax. Attenuvax is a measles only vaccine. We don't do it as now, but they do not need further vaccination.
Okay, now you mentioned about going overseas. Talk about travel. Does a person planning to travel outside the United States need to get a booster of some sort? And what's the vaccine given to those traveling outside the U.S. if they need it?
Well, like I said earlier, any person 6 months to 11 months should receive 1 dose of the MMR prior to international travel. And then once that child turns 12 months, they still need their 2-dose series. Children 12 months of age and older who have should receive 2 doses of the MMR with 28 days separating the doses before traveling abroad. And adolescents and adults who do not have documentation of the vaccination or disease should receive the 2 doses also separated by 28 days before traveling abroad. Now,
if you have the documentation that you had the 2 MMR series shots, do you need to have a booster?
No.
Okay. Now let's talk about those who may be unsure about their own vaccinations that they may have received as a kid. What should a person do if they're unsure if they're immune to the measles?
If you're unsure, first you should really try to find your vaccination records or documentation of measles immunity. If you do not have written documentation of the measles immunity or vaccinations, you should get vaccinated. But there is another option. When people are unsure, you can have your blood tested to determine whether you have measles immunity. It's called a measles titer. Lots of people will get the full MMR titer to check for their immunity, and that's one of the tests here at the health department we can do.
Oh, very good, very good. So if a person believes they've been exposed to measles, what should they do?
The preferred course of action when a person has been exposed to measles is to vaccinate all unvaccinated people.
Okay.
If a person doesn't know their vaccination status or has no record, they are considered unvaccinated.
Okay.
And so if there's no contraindications, if any person 6 months of age or older should be vaccinated with the MMR within 72 hours of being exposed.
Now, as research found, you were vaccinated as a kid, you forgot you were vaccinated, or you don't have the records and you can't prove it, and you get vaccinated again, it's not going to hurt you.
No, it will not hurt you.
Very good.
It's better to be safe than sorry.
Very, very true, very true. Thanks, Katie, appreciate it.
You're welcome. And all this information we will post on our website, Andre County Health Departments, but all the information and more can also be found on the CDC, the Centers for Disease Control and Prevention website. It is www.cdc.gov.
Very good. And if you have other questions, you can always contact us here at the Health Department at 573-581-1332, or you can stop by 1130 South Elmwood Drive in Mexico, Missouri. I'm Chris Newbrow for the Andre County Health Department. Have a good day and have good health.